Hi, my name is Kriti and we'll be talking about opioids for this following presentation. We're going to start off with this famous quote from Amelia Shepard from the show Grey's Anatomy, who was an addict to oxycodone, which is a pain medication. She said, "I am not fragile, I'm a drug addict. I've fallen off the wagon twice and I've gotten back on it. That doesn't make you fragile, Derek, that makes you very freaking strong." It is shown that drug addicts are shown to be weak, but she shows that being a drug addict is actually very strong, and there's a lot of struggles that goes along by overcoming this obstacle in your life. We're going to start off with a little bit of history of opioids. The opioid epidemic occurred in three different waves. The first wave was in the year of 1991. During this time, death involving opioids began to increase and followed along with an increase in prescribing of opioids for pain medication. Pharmaceutical companies increased the number of opioid prescriptions and claimed that there was no risk of addiction to the drug. This made opioids more easily available to the community. The second wave occurred in the year of 2010, which involved an increase in deaths from heroin use. After it became knowledgeable to the people that opioids followed along with addiction, they began to take action and made it harder to obtain the drug. This resulted in an increase in heroin use, a drug that was cheap, easily available, and potent illegal opioid. About 80% of heroin users claimed that misusing prescribed opioids before they began their addiction to heroin. The final third wave occurred in the year of 2013, during which an increased deaths to synthetic opioids like fentanyl. In the year of 2016, there was a total of over 20,000 deaths because of fentanyl. Addiction to opioids can be severely fatal and result in death. What is opioid? Opioid is a synthetic painkiller which is derived from a poppy plant. The term opioid is only used for medication that use natural opium poppy products, like heroin, which is an opioid. Opioids are prescribed by doctors in order to relieve pain from injuries, surgeries, or any medical procedures that cause pain, such as an acute pain. It is also prescribed for chronic pain, but it is not as effective. The drug travels through the bloodstream and into the brain and eventually attaches to receptors on the surface of cells. The response from this enhances the brain reward center, which is the same reaction for pleasure moments such as having sex, eating, drinking. The drug releases dopamine, which gives the body and brain happy moments. Because of this, many people misuse the drug and can result in addiction. This issue has become such a severe problem that the president had to come in and try to reduce the issue. How do you misuse opioids? When you speaking of misusing a drug, it can be interpreted in a few different ways. Some of these ways include not following the directions given by a doctor, taking the pills that were not prescribed for you, and taking opioids in order to get high. So you're not using opioids to relieve any pain, you're using it to get that release of dopamine to make you feel happier. The effect of opioids can be short-term and long-term. Some of the short-term effects include feeling of calmness, sleepiness, confusion, slow or stop breathing, nausea, vomiting, and constipation. Some long-term effects that could result in death include addiction to the drug, heart infection, lung infection, and muscle pain. In conclusion, opioid is a drug that attaches parts of your brain and body. The drug tells the brain that blocks the pain and makes you feel calm and happy. After a while, the drug begins to change the way the brain works. When your body stops consuming the drug, it causes painful and unpleasant withdrawals. This can make it hard to stop taking the drug, which results in addiction. The drug takes over your life, and getting high off of opioids has become a priority. The excessive amount of drug causes serious damage to your heart and lungs and consequently results in. Now you may ask how to treat the addiction. Doctors and researchers have found medication to help opioid addiction. Methadone and pure norepinephrine both activate the opioid receptors to prevent an opioid addict from having withdrawals. However, this still gets them high. Eventually, the brain heals and the individual is no longer an addict. Other, other, other than medication aspect to treat an opioid addiction, support from the loved one and counseling is an important aspect to also consider. That is the end of my presentation. Thank you so much for listening and have a great day.